I look at breast and prostate cancer and mechanisms by which they become more aggressive and less responsive to treatment. And so most of my students, that's the area that they're looking at.
I did my clinical work this summer in San Antonio because there are some acting professors, and I did it at the START clinic with Dr. Biram, and they volunteered to be our mentors.
In that academic setting, it makes for a better experience for us because the clinicians that are working down at the CTRC or the START clinic are interested in research, and they have more of a molecular background, and so it's just a better educational experience for us.
For oncology, we just don't have that kind of academic center for them to be able to interact with clinicians who are doing research trials. While we do have a lot of private practice up here, and this was no way a statement about the quality of the cancer care that's provided in Austin, you don't have that academic setting where you have clinicians who their mission is to teach.
Plus Dr. Biram, the doctor that I worked with, he was he was an excellent teacher. So, before every patient came in, he would go over the case history and talk about what treatments they're getting and what molecular target the treatment works on.
We are really asking clinical questions. Everything that we're going towards is with the idea that you want to improve patient outcome within the next 5 years. You want your work to directly address clinically relevant questions. And I think it's really important that they get that feeling that we are impacting a patient, that we're not just trying to cure cancer in a mouse, that we're not trying to just do tissue culture. There are real people involved with the work that we're doing.
The hardest part was when there were patients who'd come in and the prognosis wasn't good, and the doctor would have to break the news to them saying, and they all wanted to know one thing, how long do I have? It was hard to hear him say, it's not going to be, we're not talking years, which means it's just weeks to months, and their reaction was just very heartbreaking.
They interacted with patients who were being given months to live. That same patient 5 years from now, based upon what we're doing in the lab, could then be given, you're going to have years to live instead of months to live.
The goal of my research, is to improve, patient outcome for that, specific population that I'm studying. Just knowing that what I'm working on could help save a life, I think definitely inspires me.